Isabelle was a very normal, very active 17-year-old. She developed a cough. She had a cough for about 3 months, and originally the doctor thought she was asthmatic, and then he sent us for an x-ray and there was a shadow on her lung. She was actually at Combined Cadet Force camp, climbing over obstacle courses and sleeping outside when the doctor called and said, "I need Isabelle to come in and I need her to have antibiotics." But after a few weeks she didn't get any better. I took her back to a different doctor, just coincidentally because an appointment wasn't available with our family doctor, and she said, "I'd like you to go to Watford and go to the ambulatory care unit and take this letter with you and they'll see you." And we had an x-ray that night, and the next day the doctor came in and said, "We found a tumour in your lung with a spot on your liver." So she went from an ordinary 17-year-old to a cancer sufferer in about 7 days.
The Children's Community Nursing Team met Isabelle and her family after a referral from UCLH. The Children's Community Nursing Team offer support to families like Isabelle, particularly around taking bloods prior to a youngster like Isabelle going in for her chemotherapy. We know how much these children and young people spend in hospital, so our primary focus is on making sure that we can deliver as much of the care safely and efficiently as possible in the youngster's own home. For Izzy and her family, we accommodated this by making sure that we were able to allow her to continue being at school. So we'd come to her house, sometimes a little bit too early in the morning, 8 o'clock in the morning we start, to do her blood, so we could have the blood results back in time, so Isabelle and her family knew whether she was able to go up to UCLH for some treatment, which tended to be every 3 weeks. Every week we needed to be in the home because Isabelle had a central line, so we needed to make sure we followed through the appropriate line care for that as well. Every team member got involved in Isabelle's care, and that is really, really important for me as a team manager, to make sure that everybody gets to know a youngster early in the days so we can deliver a safe, efficient service.
Isabelle had chemotherapy for about 7 months, so the team would come in once a week to check her bloods, and then as the chemotherapy started to affect her blood levels towards the end of her treatment, they needed to come in a bit more often, and we got to know the whole team really well. They were very accommodating. They used to come in on a Saturday so that Isabelle could continue to go to school, and once they even went and took bloods from her at school so that she could continue as normal a life as possible as a teenager throughout her treatment. Towards the end of her treatment, it was becoming obvious she wasn't going to be able to beat the cancer, and the hospital started talking to us about what we would like as an option, and quite quickly Isabelle herself decided that she would like to be at home, and the team made that possible. It was really important to us to give Isabelle what she wanted, so we asked the team for help. Well, in fact, they offered, to be honest. They said, "Right, what do you need? And we'll provide it." And that was quite extraordinary because it wasn't just the equipment, although that's really important. There was no way UCH were going to let us come home unless we had a hospital bed and we had the drugs in place and we had all the equipment in place to look after Isabelle, and the team sorted all of that out. But more importantly, they sorted out the nursing cover, which I think gave the hospital enough confidence to let us come home. And more importantly, it gave us the confidence to come home, and it gave Isabelle the confidence to be at home. So that was really important at a really very difficult stage when the hospital had said, "I'm sorry, there's nothing more we can do." So we had, from that stage, pretty extensive cover at home from the team, who also introduced us to their hospice partner. And the hospice partner also have a team, and Mary from the community nursing team made sure that we got to know all of the hospice partners. So we were never looked after by someone we hadn't met.
One of the things that I'm particularly proud of in the way the team delivers palliative and end-of-life care is the coordination of care. It's obviously very complex care, but needs many people. and it needs the coordination of both acute and hospice partners, general practice, primary care, and sometimes social care as well. And the team always brings this together for the family, so they are not the coordinators. This is done for them by the professionals who know all the services that that child needs.
Everything that the community nurses team did for Isabelle was very consensual in that they would discuss it with Isabelle and with us, and of course we knew them quite well by then. So at the end of Isabelle's life we wanted to spend quite a lot of time with her privately, so we asked the team if they would set up in another room, and then we would come and get them during the night if Isabelle was in pain or needed some help, and that worked really well. It meant that we felt we weren't having our home invaded and we were able to have some intimate time with her and yet still have the complete support of the team. It sort of amazed me that they weren't next door asleep, but they stayed awake all night and would come through immediately, and they would check up on us during the night, and it worked really well. It meant that we were totally confident that we were giving Isabelle the best care at the end of her life. And they managed the pain relief. It's really important that your child's not in pain at the end of their life, and they managed it really well so that she wasn't too sleepy and she was able to still talk to us, still communicate with her friends on social media, and just have as normal a life as possible right to the end. We can't thank them enough.